wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. Let me ask you a question. Do you have difficulty focusing and concentrating? Do you ever find you are forgetful about where you left certain things or what you walk in a room that you intended to do when you went into that room? Do you have trouble recalling words or names? How about slowed thinking, or do you feel mentally fatigued sometimes? These are all symptoms of what people commonly refer to as I've got brain fog. So the question is, what causes brain fog? And many people say, well, it's just what you get when you get older. Just part of getting old. Although brain fog is common, it's not normal. And so it can be caused by a number of different root causes. For instance, your metabolism may be slow and sluggish. Production of energy in your body. Your hormones may be out of balance. Your food intake may be improper. You may not get enough sleep. You may be under stress. You may have inflammation in your body. So all of these can contribute to your brain fog. And so how do we discover what they are? Well, let's talk about the various causes and see exactly what is the most common and what we can do about it. First, let's talk about the brain. The brain represents about 2% of the body's weight, yet it requires 20% of the body's energy production. And how is this done? Well, it depends upon glucose, which is in our food. That's the routine energy-producing molecule that our body uses to produce energy. It also relies upon good oxygen delivery. So people that have pulmonary stress, either when they have pneumonia or they've got chronic obstructive pulmonary disease, these things can impair oxygen into the lung, and that impairs oxygen that gets into the cells, and that decreases the metabolism. Also, your mitochondria, which are your power plants in all the cells of your body, may not be producing energy properly for several different reasons. Well, one of the reasons is blood sugar. How does blood sugar affect our mental capacity? Well, our body relies upon sugar as the main energy source in the body, although fat can be used as an energy source as well. But what happens is when people have a high sugar intake, they spike their blood. It goes high, and then they get reactive hypoglycemia. It goes low, and it bounces back and forth. And this can adversely affect the way you think. And you probably have had that happen before. Sometimes you're just extremely hungry. We call it hangry, and you just got to have something to eat. You just feel terrible. You can't focus and concentrate until you get something to eat. That's because your blood sugar has gone low. You're probably on a high carbohydrate diet, eating a lot of wheat, corn, potato, rice products, and sugar products. And your sugar level goes up, and then it goes back down, up and down, and that affects your ability to focus and pay attention. You'll notice children sometimes, parents will give them sugar or candy, and maybe they're taking donuts or they're eating a lot of simple carbohydrates, but particularly candy products. And you go, but every time I give my kids candy, they go crazy. Well, their sugar level goes up, and they're full of energy. And then when it drops down, they start crying, and, they get pouty. You got to give them sugar again. You got to give them candy again. And there's this rides up and down. Well, that happens with adults too. It happens with you, and it can happen with me. So a problem develops when you have high sugar levels. Your body wants to balance that sugar out. So the pancreas, which is an organ just below your stomach, produces insulin, and insulin enables the cells to properly assimilate sugar. But if you're on a high sugar eating program or diet, what happens is the insulin, your cells become resistant to insulin, and you don't properly assimilate the amount of glucose you need, and the mitochondria, your power plants in your body, which need that sugar as a source of energy, can't can't get the amount of glucose into the cells, so the mitochondria can produce the electrical energy in the form of ATP, which they're supposed to produce. So insulin resistance, a problem is that insulin resistance also can adversely affect hormones. Insulin will cause testosterone to be produced at higher amounts, and we see this in certain disorders like polycystic ovarian syndrome, where they have when they have insulin resistance, they produce high levels of testosterone, which adversely affects ovarian function and leads to a host of problems, which will be discussed in another podcast at that time. But I just want you to understand that the insulin resistance, too much sugar leads to insulin resistance, which can lead to hormonal dysfunction in the body, which adversely affects everything in the body. All your cells are dependent upon thyroid, your sex hormones, and your adrenal hormones, cortisol, to work effectively. And if something gets out of balance, all the hormones get out of balance. So the hormones regulate your energy metabolism. They directly regulate the neurotransmitters your brain produces to help you think correctly. They affect circulation and cellular repair, all this in the brain. So if your hormones are out of balance, very commonly you'll develop those symptoms of brain fog. So the hormones are all important. We'll start with the thyroid hormone, which is the hormone produced by the thyroid gland in your neck, which has to be converted to active thyroid hormone within the cells in order to activate the cells to produce electrical energy. So thyroid hormone governs your metabolism. That's very key and essential. And things that can adversely affect your thyroid hormones are, one, fluoride in the water, fluoride in your toothpaste, or fluoride you get at a dental office. If you're getting fluoride on a daily basis, that adversely affects your cell's ability to convert inactive thyroid hormone to active thyroid hormone. So that leads to brain fog, slow thinking, loss of drive and directiveness, fatigue, mental sluggishness. Estrogen and progesterone are two primary hormones in women, and of course, in the brain, they will affect your memory pathways. Women commonly have what they call premenstrual symptoms. And those premenstrual symptoms can be anything from irregular periods to cramping, mood swings, fluid retention, weight gain, migraine headaches, fibrocysts in the breast tenderness. All these can be caused by an imbalance in the progesterone and the estrogen hormones that are made by the ovaries. Testosterone also affects the brain. It affects both in men and women, but we think of it mostly in men because it's the predominant hormone in men. Testosterone affects men's initiative, assertiveness, sense of well-being, their self-confidence, their moods, their goal orientation, their drive, directiveness, decisiveness, and analytical ability. All these are mental functions. Testosterone affects our brain function, men, and in women too. Women make testosterone much lower amounts than men do, but they do have an effect on the way our brain functions because it's one of the key hormones. So it's important to balance out your hormones. As we age, our hormone levels decline, they become imbalanced. In women, they become imbalanced as they go from puberty into menopause. There are changes in the hormone levels, and that adversely affects the body's ability to utilize thyroid hormones. And then when those hormones stop at menopause in women, there's a host of health problems that manifest themselves in symptoms, anywhere from causing depression, brain fog, not only mood swings, but also romantic moods and inclinations can be adversely affected too as testosterone drops, because it does affect a woman and men's romantic moods and inclinations. So it's important to replenish those hormones as you experience going through life, as you experience decline in hormones. And we recommend the use of bioidentical hormones. Another thing that can cause brain dysfunction is chronic inflammation. Now, things that cause chronic inflammation are a high sugar diet causes inflammatory response in the body. Poor oral hygiene, dental cavities, removal of nerve roots, a root canal can also lead to infestation of bacteria in the tooth in which the nerve root has been removed. You can get gingivitis in the gums. There's a host of health problems associated with poor dental hygiene, and the bacteria that come from the mouth get into the bloodstream, and they will cause inflammation in the body. Commonly, it will cause inflammation in the coronary arteries. And they find in the plaques in the coronary arteries, when they culture them out, they find gram-negative bacteria that are found in the mouth in those plaques in blocked coronary arteries. So you want to keep your dental hygiene in good shape. And that inflammation, of course, not only affects the arteries of the heart, but all the cells of the body and can adversely affect your brain function. On top of that, a good, healthy eating program is so imperative to keep your brain healthy. If you're eating junk food and you're putting into your body packaged or box food or food that has various dyes in it and additives, and plus the food that you may eat may have glyphosate in it that is in insecticides. All these things can be found in various food products, and they get in your system, and they're toxic to the entire body, including your brain, and they can cause a host of health problems and lead to cancer. It's a very common cause of cancer is the toxic environment in which we live. The brain should get the proper amount of vitamins and minerals it needs. And if you're eating packaged food, all the vitamins are stripped out of these packaged foods. We're talking about potato chips and this dry cereal and all this that people routinely, and donuts, all that. Those are just hollow calories. They don't have any vitamins and minerals that your brain needs to properly function. So they're key vitamins and minerals for your brain. You need to have good levels of all the B vitamins. Of course, A, B, vitamin C is a good anti-inflammatory. Vitamin D helps promote health in the immune system to keep your body healthy. And these particular vitamins are essential. Other minerals are important. For instance, magnesium. Magnesium is very important for brain function and for overall health of the human body because it's needed in the mitochondria for proper energy production. Amino acids are important, and you get those when you eat a good, healthy, balanced diet and eat good, healthy meats. And, of course, certain fatty acids, good, healthy oils. What kind would that be? Fish oil, particularly, is very good. I use cod liver oil on a daily basis. Other things that are other types of oils would be olive oil, cold-pressed olive oil. These are good, healthy oils that the brain can use to properly function. By the way, cholesterol is very important for brain function. And the medications that people take, the statin drugs, decrease cholesterol in the brain and along the nerve, the lining of the nerves, and can cause adverse effects in your thinking. They've done studies and show that people that are on statin drugs invariably have a decline in their cognitive thinking. And there's studies that have shown that people that take cholesterol drugs or people that have low cholesterol levels have a higher long-term fatality rate than people that have elevated cholesterol. This goes right in the face of everything that the doctors have been taught and are teaching over the last 50 or 60 years, and that's the drug companies because they want you to be on the statin drugs, which is a moneymaker for them. So cholesterol is important, and you don't raise your cholesterol level in your blood by simply by eating eggs or having a high-fat diet. And there are other things, lifestyle changes that can help you with your mental capacity and your cognitive abilities. Got to have a good night's sleep. 8 hours is 7 to 8 hours be good. A good night's sleep. And they say an hour to bed before midnight is worth 2 after midnight. 2 hours of sleep. Chronic stress can cause brain fog. Poor diet and lack of physical activity. All those things can adversely affect your mental capacity and your cognitive ability, whereas good sleep, good physical activity, good diet can help you clarify your thinking and be sharp as a tack. That's the way you want to be. Even as you mature, you want to have good brain functions. There's no sense in saying, well, I guess I can't think very well anymore because I'm getting older. You can make some changes in your life. You're in charge of your health. And I've described some things you can do, some causes of brain fog and what you can do to overcome that. So what we would recommend here at the Hotze Health and Wellness Center, get on a yeast-free cleansing eating program, and then eat a high protein and fat diet, and cut the carbs, the simple carbs and the sugars out as much as possible. Get down to an ideal body weight. Exercise, sleep well, balance out your hormones, and get your teeth and oral hygiene healthy. And this will help you get your brain on a path of health and wellness. So as you mature, you have energy, vitality, and enthusiasm for life. I'm Dr. Steve Hotze. If you want to get yourself on a path of health and wellness, then please don't hesitate to call us here at the Hotze Health and Wellness Center. Thank you for joining me today.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.